Welcome. Here we are at the 24th Clinical Application of Age Management Medicine Conference, where we're on the cutting edge of the future of medicine today. And I'm Florence Comite. I'm delighted to welcome Dr. Ivan Ozerov. I hope I got that pronunciation close.
Yeah, absolutely.
Okay, excellent. I know you're here working in an emerging field of artificial intelligence, or AI, also known, I think, as neural net. And
Absolutely.
I'm going to be excited to have you share what we're about to see happening and is already happening in some ways. So tell us, what's going on in the world of AI, and how could we doctors prepare ourselves for the way medicine is going to be practiced in the future?
First of all, Dr. Comite, let me thank you very much for inviting me to this outstanding event. So I'm really honored, to speak here and to be here in such a great company.
Thank you for joining us.
Yeah, and talking about AI, you are absolutely right that at the moment, this revolutionizing field, it is going on. And actually, what we mean by AI, it is deep neural networks, first of all. When we're talking about deep neural networks, mostly what people think of are various classifiers that allow us to classify objects in various baskets. And in that case, if we are talking about applications in healthcare and biomedicine, first of all, I think that we're talking about biomarkers that can be used, but these are not like traditional biomarkers when we have only one parameter, and depending on its state we can identify how will we treat a patient, for example. But this technology allows us to analyze lots of parameters, thousands or even tens of thousands of parameters, and at the same time, and come up with the solution that will be that will most fit to the particular case.
So what you're saying is, instead of one measurement, it allows for a multi-dimensional kind of look. So height, weight, and size or depth. And it kind of gets that measurement in such a way the brain can't begin to analyze. So it's analyzed by the neural network, in effect.
Absolutely.
So you can upload all this data and it can analyze it so fast in a blink of an eye, in a way the human mind really can't work in that fashion.
Yeah, absolutely. So the idea of the neural net is that it consists of artificial computational units that are connected with each other in the way like neurons are connected in our brain. And the process of training of such kind of system is that we're passing signal through these neurons, and in order to get the best results for the particular tasks, the connections between those neurons are reformed, reorganized, and finally we get the system that can predict the particular thing we want actually to predict. And a great advantage of that approach is that we can combine really various data types within one single experiment and get some comprehensive results with
So two issues come to mind, or two ways of thinking come to mind. If in our simplistic way of looking at data and the relationship and figuring out how to connect dots, we might see A leads to B, leads to C, leads to D, and maybe jump to Z. In a neural network, it might be that A really causes X, and X is the reason Z happens. But we can't even see X in our way of seeing it, but the neural network can, because it's taking into account various silos of information, so it can leap to new conclusions and come up with new observations and then connect in such a way that we can come up with new solutions and new paradigms. Is that in effect what you're saying?
Yeah, that is it. And also I can add that also we can perform feature importance analysis. So we can analyze which parameters from the input data are the most valuable to getting the proper results in the end. And that means that, for example, if we're training a system that can analyze the disease status, for example. Using this deep feature selection algorithm, we can find the features, especially genes, if we're analyzing gene expression data, for example, that are the most important here, and that may be potential single biomarkers, simple biomarkers for use in clinic, or even potential targets for further drug discovery applications.
That's fascinating. So where are you going with this? And I know one fascinating aspect of it is being able to identify the age of a person. I know it's a work in progress, and it was very interesting to hear how if you miss sleep for a few days, you know, you can look like you've aged. And in fact, metabolically speaking, when we look at biomarkers of diabetes, for example, when somebody does miss sleep or has jet lag, you actually accelerate aging within the body, and you can produce diabetes and become a diabetic, which takes weeks to months, depending on your age, to reverse. The younger you are, the faster you might reverse it. But jet lag alone has been shown, and flying is really a source of problems for many people who are, for example, in the airplane, in the industry, where it can cause infertility and other issues. So I'm wondering if you've actually mentioned something that's quite a bit more serious than just looking older because of a lack of sleep.
Actually, you know that we have recently launched our system for, you know, analyzing age of multi-level. It is like multi-level aging biomarker called Young.AI. So you can go there and upload your data. I mean, it may be picture, also blood biochemistry, urine biochemistry, and even more complex data types like genomic data and gene expression data. And this system can analyze those and you know, predict your age. At the moment, you see, it can be talking about the potential customer using that. You can track changes if you change something in the way of life. For example, you're absolutely right that we can we can detect so slight modifications caused even by jet lag or hard work during several days and stuff like that. And of course, talking about the future of those biomarkers, I'm very optimistic about that, and I believe that in general, studying aging, it is one of the most altruistic things we can do. And the idea is that if we are training our systems on aging, afterwards we can apply very specific techniques that is called transfer learning, and give a little piece of data to this particular system, and it will be able, that actually corresponds to a particular age-related disease. And then we will be able, with a very low amount of data, get a quite precise biomarker or even system to identify mechanisms of this disease that will work. And let me just give you one example. So just imagine that you see the dog for the first time. And of course, you cannot identify the age of the dog. But if you see several dogs with known age, very soon you have to see like maybe 10, to get, to know how to identify its age. That's because that you already have the neural network that is trained to identify, the age of other mammals, especially humans. And that's how this technology works, this transfer learning. Yeah.
So this is an area that doctors at age management medicine would be interested in the future to figure out exactly what they can do to keep their patients healthy and to operate in the future of medicine today by understanding what are the biomarkers that they can identify that would be predictive of disease, and they could change and actually intervene to be able to keep a person from aging, from disease emerging, by identifying the markers at risk and what are the behaviors and what are the triggers and what would prevent those disorders from emerging. Would you agree? It would help us
Absolutely.
really understand more effectively.
Absolutely.
So
I
they
agree.
should start preparing for this future world.
Yeah, actually, this future world is coming already. So
It's here.
You know, yeah.
So would you recommend that we all try to have fun on the is it Young.AI?
Yeah,
.net or is it just
Young.AI,
Young.AI and that's it?
Yeah,
and you can upload both pictures and you can enter it
Absolutely.
multiple times.
Yeah.
That sounds fantastic.
Yeah.
Well, we've so enjoyed having you here and learning more about the technology of the future of medicine. And hopefully we'll continue to follow what you're growing online. And so we'll all have access to it and welcome you back here to the future.
Yeah. Thank you so much
Thank
for
you.
inviting me.